Hello and welcome to Think Tree Hub's interviews. Today I have Paula Esson.
Hi.
And Dr. David Laird.
Hi.
Who are going to talk to us about red and yellow flags. So just to start, Dr. David Laird, can you just tell us a little bit about yourself?
Thanks. I'm recently retired. I've been a consultant in anaesthesia and pain medicine for the last 28 years in Durham. And for the last 13 years, I've been full-time in chronic pain management and palliative care. And I've been working with Paula over the last number of years, both clinically and also more recently developing courses to help complementary therapists feel more secure with patients who they may share with healthcare professionals.
Thank you. Paula, how did you get to this point and how do you know David?
Okay, I got to this point because in 2009, some colleagues and I decided to set up quite a large integrative health centre in Sacriston in Durham here. The view to being providing services that started to integrate mainstream medicine with complementary services to reach the public on a much more effective level when dealing with musculoskeletal pain, chronic pain, or conditions where people needed a little bit of extra support. So I met David at that point when providing NHS services into the building, and we realised we had a lot in common in terms of how we wanted to help people, basically.
Okay. So tell me, why is this area so significant?
You want to start with that one?
I think the NHS is in an area where the demand exceeds the capacity, where there is a large number of people who are in chronic persistent pain that cannot be met by the conventional needs, and the traditional means of dealing with it through drugs is now being shown to be more and more inadequate and to have its own burden and problems. And there is also a recognition in the pain management world that it's not just about trying to manage pain or relieve pain, because that was the initial goal, but it's actually helping people to live better lives, to have a better sense of well-being, and coping with what they're having to cope with.
Okay. So what are the changes in the NHS?
Well, there are many changes. A lot of you will know from your own local services that some of the services seem to be more streamlined and put into pathways, and some of them are outsourced to private companies. But yet that may help people who are in the centre of that disease condition, but for people who are more complex or whose condition requires more individualised treatment, maybe at the start, so that they could enter that type of pathway, they may not be catered for as well. And that's leading to more people, I think, now looking outside the traditional NHS resources within their primary and secondary care.
Okay. So how can we cross the disconnect between mainstream healthcare and complementary therapies?
Well, from my experience over 20 years of training therapists, we have a multitude of very talented therapists out there from across the field who've often come from other professional careers. And because of their own personal experiences or family members, they have seen an opportunity. Mm-hmm. And when they get into that training, often those courses are reasonably short in comparison to mainstream medicine training. So a mainstream medicine doctor would take between 7 and 10 years, isn't it, and more to get to the top of what they're doing. I was a consultant level 20, isn't it, or something like this? Yeah. So therapists are training in like under a year, and I think this has caused an interesting sort of observation in terms of the disconnect between mainstream medicine and complementary medicine, and I think rightly so. That there's a lot of skill bases there that are being missed in their training process. And there are degrees now in complementary therapy, which is excellent, but a lot of therapists are training in a short period of time. So although these therapists are very competent, incredibly capable at their jobs, and have really good success stories anecdotally within their clinical situations, The disconnect is when they try to then communicate and the person looks at or the doctor looks at those qualifications and then struggles to match that up in terms of feeling that has credibility, that they can trust that person to deliver a service that follows the same governance and standards that the NHS would do. So for us, it's about providing training and education that starts to, deliver where that gap is.
Okay.
It's pretty essential.
I can see why you're doing this, to raise the quality and the standard, and also I can see where this would benefit complementary therapists, any therapist. However, there is a baseline standard that everybody has to reach. There needs to be one, because otherwise we would be all over the place. So when you're looking at these red and yellow flag courses that you produced, are you taking that into consideration? Where's your starting point?
Well, I think the point you raise is quite perceptive in that the individual therapists, there are quite a wide range. There are people who are new and there are people who are very experienced. There are people who do it for a very limited time in the week, and there are people for whom it's their main livelihood. But as well as that, the client base, the people who they work with, also vary from people who are essentially well but want to top up their health and well-being, to people who are quite ill, either palliative care needs or who may have ongoing health concerns or who may have been failed by conventional NHS therapies. And then in addition to that, there's the local provision and how the interface is with that. And that's where the local commissioners who are responsible for providing healthcare into that community and paying for that, they will set a series of standards. And as well as the standard of helping people to improve, which is not related to a specific complementary therapy, but is related more in terms of improving function, mental health or physical function, they also want assurance that that therapist meets governance standards, that their learning and training isn't just present from 10 years ago, but is up to date. It's been refreshed. They want to look at clinical effectiveness with audit of patient-reported outcome measures, which are ways of showing that treatment for that person is helping them to improve their physical and mental function, and that they are learning to self-manage their condition as well. And I think one of the fears of commissioners is that if they were to open floodgates, that we'd be in a New Zealand position whereby therapists would just see patients on a continual basis, but there would be no exit strategy. Actually, we want to improve people to enable them to achieve more independence. And the red flags are designed for safety, to identify the ill person who presents amongst the symptoms that they're presenting with. And that's one of my concerns. I went into anaesthesia and not general practice because I thought I couldn't identify the sick person in 100 that a GP has to pick out every day, every week. I want to share my experience in the chronic pain world with how we can use red flags to help us gain confidence with that, and then to communicate that with other healthcare professionals. The yellow flags is about identifying barriers to rehabilitation. There are people who we think, we should be going well here, this person should be improving, I am doing the right things, but we seem to have hit a plateau. And it's identifying what is going on. And there's a structured way to assess that and to progress and help the person through that. So it's sharing some of that in a way that's replaying and reinforcing the clinical governance standards so that people who come on the courses are able to communicate effectively with healthcare professionals, able to deliver what a commissioner is actually asking for and not just what they think the person needs. And that's something that in the health service we are having to relearn, that secondary care has to provide A, B and D, but not C, because C wasn't commissioned for whatever reason.
Okay, thank you. So, for those listeners and people watching who maybe this is the first time they've come across red and yellow flags, can we just summarise in lay terms what that would mean? Obviously, Paula, you've worked with therapists for a long time. What does this actually mean to them?
Well, from my observation as a professional therapist, it's as important as, say, your first aid qualification is, in terms of the importance of that. And the amount of times you actually need to use your first aid qualification in a therapy setting, which is a safe environment most of the time, is actually small. But with the red flags course, what it's doing is allowing you and helping you with, I think the phrase that you were using, Dave, was a good one, was a reasonable reassurance. Be able to give reasonable reassurance and make reasonable observations in relation to a number of presenting factors. So if you're treating someone for a few weeks, like 3 or 4 weeks, and they're making zero progress, and their sleep patterns are changing, their pain is changing, their energy levels are going down, they're disengaging, there's all sorts of things happening, that we are trained to actually recognise those signs and signals so that we can then make reasonable identification to refer. And then that can be numerous things we've identified, isn't it? It's non-specific type lower back pains, it could be headaches or presenting visceral or gastric type symptoms that may need further investigation. One thing I was looking at NRHP was we had a few on the sort of diabetic neuropathy, and seeing that and witnessing that in the lower limb was like, oh, hang on, I'm going to refer this back to David. And sometimes we were correct and it was the right observation. So that teamwork is essential in that. And so that the opportunity for therapists here to be, as I said, the eyes and the ears to assist, GPs and NHS, which is under pressure, is the opportunity is huge, and the workforce is there and capable to be that if we can increase this credibility.
Actually, just to pick on that point, there are some fantastic therapists out there who have trained for absolute years, and through experience and understanding their clients, they are quite observant, and maybe this would just give them a bit of structure, a bit of guideline as to how to help them. And the fact that you're collaborating together means that you're bouncing off ideas, you've been able to kind of challenge each other's thoughts a little bit, and so forth, help the therapist, help the patient.
And the other aspect of that is there is a huge push now to develop apps and artificial intelligence in digital health. But what some people are finding is that when people are given these, that it actually increases the referral rate. So a service that's already under capacity, and that its demand is great, the demand goes up because the filtering isn't happening as well as it might do. And that's where the use of therapists acting as extra eyes and ears, especially over a period of time, adds a dimension and could be a real source of backup to GPs and other primary healthcare practitioners, because they can identify things that are relevant at an early stage, but it can be couched in terms that it's heard by the healthcare practitioner because we speak the same language, and also it allows the healthcare practitioner to identify that and to make their own observations. So it's not done on this is the definitive diagnosis, you must have that scan. It's on a much more collaborative basis, which then supports respect between the different areas, and therefore people are more likely to listen and make use of that.
That's interesting because it puts the complementary, back into complementary therapy, because that's what it is. It's a support for people like yourself as well. So you've got a number of courses that have been accredited through ThinkTree, and they can be found on our website, and also you've written a blog for us as well, which is also now released on our Facebook page as well. So tell me what's next. What's planned, and how do people engage with these courses?
That's quite straightforward. You can go to just the ThinkTree website, and you can also go to safetomove.com as well, and look up under the courses tab for the red flags. A very simple, straightforward booking system. And we have courses running all over England, Iceland as well, and is in there this year, reaching quite a few therapists from across the UK, from north to south. So there's about 10 courses there over 2019. This is the first step out, really. We did do some courses previously, about sort of 8 years ago. It was like our pilot course. It showed the need and the demand for this. And then moving into 2020, our intentions are, I'm sure you'll get involved with this, is to expand the portfolio of delivery, so that each one of those bits that we spend an hour on can actually be a whole day course or something that's someone's particular interest. So it actually becomes a whole curriculum of supporting courses for therapists to just keep improving that credibility. So when they interface with the GP and the interface with the doctors, that their narrative, their approach, their identifications, everything matches the standard, and which can only ultimately help the client at the end of the day. So this is progressive.
Excellent.
So these are being designed as a series of mutually supportive modules, which can be taken on their own, but together start adding up into quite an integrated curriculum addressing basic to advanced communication skills, looking at the different flags for conditions, physical conditions with red flags, mental health with orange, barriers to rehabilitation with the yellow flags, but also then looking at tools and models that I have found of use in my 28 years and are well established in the pain community, from grief model through to crisis model, which helps people in one area, but also working through to things like motivational interviewing, helping people to make behavioural change, and also supporting lifestyle changes with sleep, nutrition, activity, relaxation, and purposeful activity, and in fact, having fun. Because one of the things with chronic pain is the first thing that goes is fun.
Joy and fun.
And it's helping people to get some of that back in. Otherwise, their life is running on empty.
Absolutely.
Their tank is empty.
Yeah, that's interesting. So tell me then, how do ThinkTree members, how do they benefit from, say, doing one of your courses or being part of your...
Oh, yeah, they really do benefit. If you go into the Red Flag booking course form, you'll see there's an option there for ThinkTree members only, and that knocks off a 10% discount off the course price right from the start, and that applies to all of our courses if you already belong to the ThinkTree hub, because we're associated with ThinkTree because of the professional standards and alignment that they're providing at the moment, and it's incredibly refreshing to be in it.
Excellent.
And we're developing resources. So before a workshop, there'll be self-assessment questionnaires, some resources, some reflective work to do. Yeah. Then after a workshop, which will have physical and media resources embedded within it, so you leave with substance as well as the content of the workshop. There, we hope to develop the opportunity for mentoring and coaching, as well as furthering the support with the Federation in terms of developing your portfolio and your professional development. So it becomes much wider and deeper than just a tick box on, I went to a course on this.
Excellent.
And importantly, it aligns with the mainstream model as well. So that, when I watch how the nurses are trained, and other health professionals that I know, they are constantly working on that reflective portfolio and adding to it all the time. And that's a structure that's a little bit disconnected within complementary healthcare as well. They have one portfolio that you're working on the entire time, then that starts to totally align with mainstream as well. So it just works towards a more natural acceptance of both models.
Well, I think this is fantastic news for our therapists, for our industry, and I also would encourage Thinktree members to join and maybe come along to one of these courses and help them progress. But I'm also very pleased to hear that there is further development, and we will use that information and send it off to our readers, our members, and anybody else that's interested in healthcare as well. So is there any final things that you'd like to say to our members or anybody watching?
I think one of the things that I find is that when you're with a person who is in pain or has a condition, you're treating them as an individual, but you are also an individual.
Absolutely.
Which can make you feel quite vulnerable. And actually having peer support, having almost a virtual college of people around you can help affirm that what you're doing is right, that your limits are appropriate, and you have confidence in how you can refer on to others. But that coming together of people, either at workshops, socially, can help to provide that confirmation and the confidence so that you can deliver your skills in an appropriate way.
Thank you.
It's building these relationships. It's really important.
Excellent. And something you said there, which is something that I've been talking about for years. Every therapist needs a therapist. Needs a therapist. Needs a therapist. So I would like to thank you ever so much for doing this interview with us. I'd like to wish you well and encourage you on your journey. And obviously any part that we can play in helping you with that, we will be absolutely delighted to be involved. So you can find details of the red and yellow flags courses on the Thinktree website under Find a Course. There's also a blog there that they've put together for us, and further information should be coming. So that's www.thinktreehub.com, and we look forward to our next set of interviews. Thank you very much.
Thank you, Kush.
Thank you.
Thank you.
Thank you.
Bye-bye.